so let's review the questions one by one. All right. So your first question was, what should staff members when do first when dealing with an angry patient? Right. Now, do you have any? I mean, does this question confuse you? Do you know why we chose the first answer? So the first thing do you do when you have an angry patient? With patients, whenever you're dealing with patients, your first job is empathy. Okay, you have to express your empathy with patients, and that is why it is important that you start by acknowledging the patient's feelings, and any the other three, terminating the episode, asking the patient to calm down, redirecting the topic, all of these will only serve to aggravate the situation. Okay. So that is why it's a straightforward question. You will acknowledge the patient's feelings. So let me give you a tip there. So when you're reading the question and you're looking at these answer options, right? You should what is helpful is when you read the answer options, think in your mind quickly and make that quick. Think in your mind about why this answer may not be appropriate. Like, I mean, as professionals, right, when you are working in a complex adaptive system like healthcare, your job is to engage in some down the board thinking. You have to be able to play the scenario out in your mind for the next few steps and decide, right? So that is exactly what you have to do on these questions on your exam. I mean, you look at this. You look at the second option. You terminate the episode. Okay, so if I terminate the episode, what could happen? How would the patient react to it? Okay, if I ask the patient to calm down, what would the patient do? The patient would again erupt and redirecting the topic. So you have to think through each of these answer options and decide in your mind why it may not be appropriate. So if it doesn't seem appropriate to you, even a little bit, you could set that answer aside. That is not your best option. Okay, so that's one way of answering. Is the audio clear to you all? Are you able to hear me properly? Yeah? Okay. So, second question. In deciding whether to apply for an external quality award, the first step is to determine if the award criteria. So we talked about it. We talked about it yesterday also in the performance measurement and process improvement module. That everything that you do in quality, it has to be first aligned with the overall vision and strategic plan of the organization. And when you're applying for awards also for quality, um, your first job is to make sure that this is something that is important to the organization. This has to be an organizational priority. Okay, if it is not, then there is no point. Why? Because if it is not an organizational priority, you will not get leadership support. You will not get the resources. You will not get the support of the staff. So it is you're setting it up to fail. So that is why it has to be aligned with organization. Now, does it have to be approved by the board of directors? Yes, but that comes later on. Determine if the award criteria demonstrate excellence and quality. Well, if you're applying for an external quality award, a recognizable external quality award, it is definitely going to demonstrate excellence in quality. And determine if the award criteria require more policies to be drafted. That is not. I mean, that answer is clearly wrong. You don't need to look at that. Okay. Then, which of the following is essential to an effective quality council? Involvement of leadership, consultation of the legal advisor, participation of the strategic planning committee, direction from the organization's quality department. Now, here you could get stuck between choice 1 and 4, right? Because consultation of the legal advisor, well, it doesn't seem very right. Participation of the strategic planning committee, it's not always required. Okay, so those two options are clearly out. So now it is between involvement of leadership and direction of the from the organization's quality department. Now, the direction of the organization's quality department is definitely required. Okay, but the first thing, like I keep saying, the first thing for a quality program to succeed, for anything that you do in quality, is the involvement of leadership. It is the leadership commitment. Okay, so that is the first thing that is most essential. Okay, with which of the following does quality leadership start in contrast to management by results? Okay, Profit and loss, clearly that's not the right answer. Return on investment, again, it's a financial function. It is important, but quality leadership doesn't start with that. Current products and services, no, that is a management function, not necessarily a leadership function. And quality leadership always begins with the end user. You're always starting with the end user. Okay. Okay. So the question is, which of the following requires greatest amount of education? I thought who needed more insight. Okay. Now here's the thing. Um, let's look at options one by one. Okay. Which of the following leadership styles requires the greatest amount of education and training for staff? Now, if it is an autocratic style of leadership, it clearly, I mean, the focus is not education and training. It's really the leader telling you what to do. You go and do it, and even the education is dictated, so to speak, by the leader. Okay. Now, four is not the answer. None of the above is not the answer. Now, let's talk about laissez-faire. Now, laissez-faire means the leader is not involved. Okay. Now, when the leader is not very involved, when it is leadership by absenteeism, when the leader does not show up, the leader is not visible, the leadership is not visible, you cannot go into education and training. Okay, because education and training is the second step. The primary step is the visibility of leadership. So what you need to do is need to first establish leadership for any project or for your program. Okay, so if not the main leader, there should be at least some other ground level leaders who will provide day-to-day leadership. Once that is done, then you can look at education and training. So even if the staff were to get a lot of education and training, your QPI program will fail in a laissez-faire leadership style, because there is no leadership support, there is no commitment, and sooner or later the staff will face burnout and stress, and they will give up. Okay. Now in participative leadership style, everyone gives their inputs. Okay. So the leader so creates a democratic setup where everyone gives their inputs, everyone's opinions are valued, and everyone contributes, and everyone is involved in decision making. When that happens, you need people to have a certain optimum level of expertise. Okay. And to get that expertise, you need to give education and training. Okay, so they need greater amount of education and training in case of participative leadership, not laissez-faire. Does that make sense? Yes. So yes, so the staff would need, yeah, the staff would need the leadership, and yeah, I mean, uh, yes, I mean, when you're talking about different leadership styles, you start with the leadership style of the leader, okay, not of the staff. You start with the leadership style of the leader, and from there you extrapolate, um, how the whole scenario is going to play out. Okay, so I hope that makes sense. Okay, so the next question is, the primary purpose of baseline data is to determine whether there is an important issue to address. Okay. Now, make a comparison to demonstrate successful performance initiatives. Definitely, that is one of the purposes of baseline data. Okay. So one is also correct. Primary purpose of baseline data is to determine organizational priorities. Yes, that could be one of the functions of baseline data. Meet hospital accreditation standards and regulatory compliance. That could also be a function of baseline data. But the most important use of baseline data, okay, the first and foremost thing that you use baseline data is to first find out, is there anything, do we have a problem at all? Is it something that is worth working on? Okay, that is the purpose of baseline data. Okay, all right. Next question. Ultimate responsibility for ensuring that data collected in the operating room are transformed into information lies with the director of the operating room staff, the surgeons, the board of directors. This is a straightforward question. Remember, the ultimate responsibility for everything that happens in the organization falls with the board of directors. Okay, so whenever you hear ultimate responsibility, look at your options, go to the guy sitting on the top, okay, in your options. So in this case, it's the board of directors. Okay. Now, how can the chief executive officer best contribute to the success of a key improvement project in her organization? Assign a quality professional to assist in the project, conduct regular in person reviews, offer financial incentives, personally select members of the improvement team. Now, can you tell me which of these options is not um, this question? How can the chief executive officer best contribute to the success of a key improvement project in her organization? Okay. Now, which of these answers is clearly not correct? It's four. Okay. Because the chief executive officer will not personally go and select members of an improvement team. What sort of leadership style would she be displaying if she did that? Yeah, she would be that would be an autocratic style of leadership, right? I mean, that would be a micromanager. Someone is personally monitoring everything that is happening. No, that's not what a leader does. Now, offering financial incentives, that could be one of the steps. I mean, because you have to reward the people who are there, who are performing your quality improvement functions. Assigning a quality professional could be one of the answers, but the most important thing that the CEO can do is demonstrate her commitment to quality improvement, and the way she does that is by conducting regular reviews of the different projects, so people in her organization know that uh, that she clearly means business when it comes to quality. Okay, so Michelle, are you saying that you answered correctly on that question? Right, right, you're right. So so visibility is very important, demonstration of commitment is very important. Okay, then the next question is, which of these is an organizational measure? Okay. Now, okay. Now, which of these is an organizational measure? Prophylactic antibiotics received within 1 hour, unplanned return to theater, percent of clean surgery patients with surgical infection, or percent of surgical cases that were started on time. Okay. Now, in this case, um, okay, so you chose one. Um you have different kinds of measures. Okay, you have organizational measures, which are the system level measures. And what do those measures do? They give you clues, or they give you signs about the larger system level aspects. And then you have departmental measures, or you have lower ground level measures. Okay, so look at measures within those two categories. Now, the system level measures tells you about how we are functioning as a system. Okay, so the choice 4 is percent of surgical cases that were started on time. So that tells us about the timeliness of care. Okay, are patients about to get are patients able to get into our system on time? Are they getting the surgery or the care they require on time? Are they leaving the system on time, etc.? Right, so that is why it is an organizational measure. If you look at the other three, all the other three are sort of departmental measures. They've got to do with infection. They have got to do with what is happening in that particular department, that is specific to that particular clinical microsystem. Whereas 4 is the only option that tells you the larger picture. Does that make sense? Yeah. Okay. Okay, now the next question is, progress of an improvement project has stalled. One of the main issues identified was that a few loud naysayers were blocking implementation of ideas by the rest of the team, which suggests what? Okay, so um, now here, which answer is clearly wrong? Which one can you rule out outright? Yeah, exactly. Too many physicians on the team. Don't ever point fingers at physicians, right? So that is clearly wrong. That is not the answer. Failure to execute changes, that would not lead to blocking of implementation of ideas, right? Because what that would mean is they have implemented the ideas and the ideas have failed. Okay, so two is also not right. Absence of strong enough ideas for improvement, no, that would not lead to conflict. Okay, the only reason conflict will happen is when there is no commitment from the leadership, when the organization clearly doesn't demonstrate their commitment to have improvement projects. And because of that, when they see that the organization itself is not serious about improvement, then the people, the naysayers and those laggards and the skeptics in the organization will start raising their voice, right? And they will clearly block implementation of ideas. Okay, so again, this question points to what? It points to the importance of leadership. Okay, so anything where, whenever you get such questions, if it gives you any clues about the involvement of leadership or leadership commitment, that is your answer. Okay, that should be your first choice. All right. Okay, so those were our questions for the first module, quality leadership and structure.